So in order to test a blood glucose, if you have a calibration style meter, you need to use a calibration stick, which tells the meter the lot number that your test strips are from. So this one's red, 69163. That means I need to use lot number 69163 within a reasonable expiration of the same type of test strip. So I'm going to open my test strips, bring it out, and place it in the meter. And I will ensure that it says 69163. It's now asking for a drop of blood. So I'm going to be testing the blood glucose of my patient here. Now generally, if they're right-handed, it's nicer to test on their left hand. And you want to test on the side of the finger rather than the front of the finger. So I'm going to wipe it with alcohol, fan it, let that dry while I set up my lancet. The lancet is a spring-loaded device that has a needle inside it. That will generally allow us to express a good drop of blood. Now you'll need a reasonable amount of blood to take a sample. And so if your patient's hands are cold or they're otherwise not bleeding, you want to be able to make sure that you've got enough of a blood drop in order to be able to fill the test strip of your meter all the way up to the top. So a properly calibrated meter. And we can wipe this and give them a Band-Aid if necessary to stop that bleeding. So they have a blood glucose of 92. Now you want to make sure that you dispose of your sharps properly. All of these lancets will work differently. And continue from there. Now, in a lot of situations, patients may have their own meters, which do not require calibration, especially if they are diabetic. A home meter is appropriate for you to use as a EMT. This is not one that requires calibration, but you do need to verify that it is the right kind of test strip for the right kind of meter. And so this is now asking for a blood sample. We'll see if our patient still has, nope. Okay. Too small a drop and we will not get a sufficient sample. That's a good one. Ready for sharps. And After the bad date of message.